Well, good afternoon. Thanks for being here. Right to the point today. Our healthcare systems are surging, and our healthcare workers are extremely busy right now with both COVID and non-COVID cases. They are managing, but they are busy. They're implementing their surge strategies to deal with this increased demand. And so first off, frontline medical staff, we see you, we notice you, we appreciate the work you're doing right now. But we're in a tense spot. And quite honestly, we need this region and each of you to do your part. We need more. Our schools need you to do more. Our hospitals need you to do more. Our vulnerable populations need this community, this region to do more. And I have an expectation of residents, and I'm not just talking residents of Sioux Falls, I'm talking to our entire region right now. The majority of the inpatients in our Sioux Falls hospitals are not from Sioux Falls, from all over. This reinforces that there's a level of diligence across this region that we need right now. Approximately 15 to 20% of staffed beds right now are being used for COVID. What that signals is that deferred care is also becoming an increasing issue in our hospitals. Let me stress, if you are over the age of 65, you need to be extra diligent right now. I'm not going to tell you what to do if you're in that age bracket. You need to be diligent, you need to be responsible for your situation. Friday, myself and the mayors of the 16 largest cities in the state, we represent roughly over half of South Dakota's population. We sent out a unified message of what we need from our communities right now, from this region. Wear a dang mask when you're indoors. We're not asking you to sign up for the draft here. We're asking you to wear a mask when you're inside and you can't distance. Social distance, take that seriously. We have let down our guard tremendously on that. That needs to be taken seriously. The hand hygiene protocols. This is stuff that shouldn't be a surprise. We've been talking about it since March. But now we're at the time when we need the diligence on these items. You know, the current political tensions in this country are certainly impacting this issue and impacting us as leaders at a local level. Part of my job as a leader of this city is to take action as well as to avoid action to ensure we remain as unified as we can right now and avoid division and chaos in a tense local and national dialogue that exists. You're going to continue to see strong expectations from myself and those other 16 mayors across the state asking our residents, again, to do their part. We need you to do your part. This is a chart we're not proud of. This is a trend we need to reverse. You've all seen it. You see it every day. We're getting a lot of attention over our increased hospitalizations, our increase in active cases. This is the trend we have to reverse. So one of the messaging components you're going to start seeing is this. In partnership with Sanford and Avera, we're promoting mask wearing whenever we can. This entire room is masked up. You're going to see a lot of these campaigns in the community. You're going to see billboards. You're going to see social media campaigns. You're going to see PSAs. We need you to mask up right now, and we need you to take that seriously. I am not sure when or why this issue became so dang political. It's quite ridiculous, if you ask me, how political this has become. This is not an R or a D issue. This is a public health issue. And at times I'm embarrassed about how politicized this has become. There's a lot of anger right now. There's a lot of fear over this virus. And what I'm asking you to do today as well is try to control that anger and that fear. We will get on the other side of this. But I'm also asking for a level of unselfishness that, quite honestly, many people are not used to giving. That's unselfishness that says, I'll wear a mask for other people. I'll avoid groups. I'll avoid large social gatherings on the weekends. I'll think of others before myself. And so if you want to live in a state that gives you freedoms, that comes with an expectation of responsibility. And I need this region to do more right now. I'm going to turn over to Dr. Basil with Avera.
Thank you, Mayor. Yeah, there's no doubt that we have seen a significant increase in hospitalized cases over the last month or so. Probably the numbers have roughly doubled in that time. We have initiated early stages of our surveillance plan. One of the nice things is that we had a good run of using our surveillance plan last spring. This time it's going to be more of a stepwise process, and so we're trying to keep as many things open, as many things running at all times, because we can't just keep deferring that care. We've got to make sure that we're doing all those things to prevent strokes, to prevent cancer, to keep people's diabetes under control. All of those things, this has turned into a marathon, not a sprint, and so we've got to keep all of our long-term care going at the same time we're managing these increasing COVID cases. So some of the early stages, some things that we've been doing. So for example, we've opened up more ICU beds. If you'd asked me 6 months ago how many ICU beds in your main medical ICU, I would have said 20. Over the last couple of weeks, we've increased that into the mid-30s already, and we plan to increase that further this week to care for those increasing cases. That's one of the reasons why when you ask me, do you have any beds, we've got surge plans so that we can ever increase that number of beds to meet that demand, and we're still confident that we have the ability to do that. But there is a limit to that, and so we will keep a stepwise, increasing, asking people to work more shifts, being able to handle that surge. We do see ongoing that, all projections are showing we're not done yet. With the number of cases that we're seeing, the percent positivity that we're seeing out in our communities, that number is going to continue to increase and potentially increase pretty significantly over the next month. And so we have plans in place to handle that. But I do agree, Mayor, that we do need the public's help with this. There's a limit to how far we can increase. We also agree that we've got to keep as many things open, our schools, our businesses, our economy, as much as possible. Our ability to do that depends on each and every one of you, and how can you help? Masking is probably first and most important. Masks work. Back in February, we didn't know whether masks worked for COVID. Now we have solid data, masks work, and they work pretty significantly. Where we're seeing it spread mostly is when people aren't wearing their masks, sitting down at a table together during their lunch break, within the healthcare system. We're not seeing cases getting transferred, between a patient and a healthcare worker. We're seeing it because they sit down in the break room or sit down at a lunch table. Those are some of the changes that we've had to make that's proven to us that masks do work, because when we're wearing the masks, we don't see the transmission. When we don't, we do. You mentioned large gatherings. That certainly is a time where one person can infect many, but small gatherings are also important, especially now as we're coming indoors as the weather gets colder. An outdoor gathering is certainly less risky than an indoor, and even small groups as you come indoors, think about, how you can incorporate masking into that when you get just a few families that come together, how you can reduce the spread in those settings. We flattened the curve this spring. We can do that again now while still keeping as many things open as we can. My kids are in soccer this fall. I want them to be able to continue doing activities like that as long as we all do them safely. Another way that we can help with that is if you have even mild symptoms, stay home. There is so much overlap on the milder cases between the common cold and other common mild infections that you really can't tell. There's certain things, if you lose taste and smell, you have COVID. But there's so many other things, mild cough, runny nose, stomach upset, those sorts of things that can be COVID and be pretty mild. And so if you have any of those symptoms, don't go to work, don't go to school, get yourself tested so that we can get you ruled out and isolated. And isolate until you get that test result back. We are working diligently to decrease the turnaround time so that we can get those results back to you quickly for that. And also important is if you are within close contact to somebody who is positive, even though you feel fine, it's so vitally important that you stay away from others and isolate for that 14-day period, because it can take 5 to 14 days for symptoms to show up after a single exposure to somebody who's been positive. And so there's no way of knowing or predicting. We can give you a test, but just because that test is negative doesn't mean you're not going to turn positive later on. And you could start infecting people days before you ever turn symptomatic. So it's so important to stay isolated during that time period. I mentioned that we're trying to improve access to testing and continually increasing the number of tests that we can run on a daily basis. One of the next steps that we have in that process is that we are this week opening up a new testing location for drive-thrus at 23rd in Minnesota. So that's an old Vern ID location that was bought by Silver Star, and they graciously did a short-term lease for us so that we can have another testing location other than our West Side location, and we can really reduce the wait time for people that need to get that test. And so we're really excited about that ability to reduce the barriers to get testing go through. And so I think that'll be a real step forward for us and for the city. Lastly, I just want to say thank you. Thank you to the public that is already doing so much. I was at church this weekend. 95% of the people in church were wearing masks. They're doing their part. Thank you. Thank you to all of the workers in grocery stores and other businesses that are working and keeping things running as this goes on and on. But most importantly, I want to thank you to the healthcare workers, the frontline workers, the support workers who are helping us care for all these patients. Again, we are asking for extra shifts from individuals. We are asking for longer hours from nurses and care techs and social workers and first responders and everybody. And it's taken its toll over time. But we stay strong, we stay positive. Sometimes it's hard. There are so many tragic cases that we have to deal with COVID daily. Families, husband-wife teams that come down with it, and one of them makes it and the other one doesn't. The way it spreads through households and just hits one after another can just be so big of a tragedy. And to healthcare workers, that takes a toll on them. And so thank you for everything you do. You are making a difference, and you will continue to make a difference. Thank you.
Thanks, Dr. Basil, and Mayor as well, and good afternoon. I'm going to start with a thank you as well. As Dr. Basil pointed out, there's a lot of people in traditional healthcare roles, but also those that teach, those that coach, those that work in the restaurants, grocery stores, et cetera, are really stepping up during this time. And sincere thanks to them. Thanks to all those that work within our facilities as well, those folks that are answering the call at all hours, even though they expect, to maybe be able to relax a little bit. We absolutely want people to focus on that, but there's times when people will step up as well to help us take care of those coming to us in need. As already stated, we continue to see COVID, but also patients coming to us for non-COVID needs as well. And I've talked now a couple of times about this typically is a busier time of year, and that certainly continues for patients not only with COVID, but other needs outside of COVID as well. One of those, as the mayor pointed out, being needs that care needs that perhaps were deferred earlier in the year. and now are being addressed and may take a little more complexity in their care to get that addressed at this time. We continue to prioritize really that care closest to home, what makes sense, and a lot of people are working to achieve that as well. A lot of people come to us asking, what can I do? And a thanks also, like I said, like everyone has said so far, to those folks that are really engaged in helping to fight this pandemic. And patients do come to us asking, what can I do? And it's really a thanks for listening to the message and being willing to listen with an open mind as to what I can do, even though I may not necessarily be around a lot of patients in my community or a lot of people in my community. We're seeing that those populations as well are vulnerable at this time. This virus does get to visit everywhere. And so some of the things that we see from a hospital standpoint, but just taking care of yourselves. Group gatherings has been mentioned, and I think now's a good time to probably talk about your holiday plans. Unfortunately, due to this pandemic, there may have to be some alterations this year. And people just need to, and I have tremendous confidence in people to thoughtfully have a conversation with your families, your loved ones, those around you to, hey, what's Thanksgiving? What's Christmas? What's that going to look like this year? Do we travel? Do we get together in a large group, or does it just not make sense right now? Another thing, and we encourage this in times of pandemic, just really any time, and that is to focus as a patient on your advanced care planning. You have the ability to make your wishes known at any time during your care. And usually when the care is more acute is maybe not the best time, but rather if you're having a routine follow-up visit with your physician or nurse practitioner or PA, talk to them about your advanced care plan. Does it include hospitalization? Does it include life support or aggressive care like that? Or is it more a focus on comfort? And we have, in our primary care offices, that availability is there to have that thoughtful conversation. I've been involved with many powerful patient interactions where the family may have to step up and make that decision on a loved one's behalf, and it can be really helpful to have those wishes, and it has been really helpful to have those wishes really spelled out as those needs may arise. The next thing, if you do, start planning about how a discharge from the hospital is going to look. Have conversations with family, loved ones, coworkers, etc. We typically are able to be very transparent with you during your care as to, hey, it's looking like maybe the next day or two we could probably get out of here. How are you going to get home? Is someone going to come get you? Did you drive yourself? Are you able to drive now? And just things like that can really help us as we transition patients from the hospital to the home care setting. And I'll just wrap up with, as I alluded to earlier, really a thanks to everyone who's stepping up during these really challenging times, working hard to meet patients' needs as close to as home as possible. We had a very powerful interaction with our Good Sam facilities, Good Samaritan facilities, in addition to our network facilities. As you know, we not only have the facilities here in Sioux Falls, but across the upper Midwest, western Minnesota, northern Nebraska, northwest Iowa, and eastern South Dakota. And the ask at that time of the network and the Good Sam facilities is, what can we do? And certainly our network facilities have been caring for patients with needs as they can meet them as close to home as possible. But then some of these folks that we take care of in the hospital here can be difficult to transition to home, and they may need to stay at one of our outlying facilities for a couple of days as they recover. Our Good Sam facilities stepping up to say, even though we're stressed from a staffing standpoint, we're going to step up and work with some of these patients as well to help them transition to home. So really a humbling time, a busy time, and continue to work hard to meet patients' needs. So with that, I'll conclude. Myself, Dr. Basil, and the mayor are here for questions.
Is there something wrong with Sanford testing October 11th to the 13th when we put out extra false positives, and did that affect Good Samaritan testing numbers?
So the question is testing opportunities identified in the October 11th?
October 11th to the 13th.
11th to the 13th.
Series of false positives that
Okay.
came out.
So we have several analyzers at Sanford, not only in the hospital, but in our facilities on the north side of town. And a couple of those analyzers we questioned the results, and it was actually picked up very early that we could have some erroneous results, and that is being worked through as we speak, and communication with primary care providers to identify patients if testing is still appropriate or what we need to do. And I can't speak to where that exactly was located, where those patients that maybe had positive tests were identified. And we still don't know exactly if the positives were true positives or false positives, but it does seem it was questioned early, and those analyzers have since been taken offline for repair.
So are you retesting everybody? Just to follow up on that, are you retesting everybody who's involved in that, and how many people?
Right. So the question is, are we retesting? And currently, what we're going to do is we're going to have that really up to that person's primary care clinician to make that determination if it makes sense for them to test or not, and then offer that if that's the case. And the number of patients is between 400 and 500 across all of Sanford.
That's quite a few.
I have a question for the mayor. So just kind of going back to the holiday season, we have Halloween, Thanksgiving coming up. Are there any recommendations that the city does have, maybe in terms of trick-or-treating?
The short answer is no. I'm not, the mayor doesn't control trick-or-treating, so I'm not really going to make any mandates about that. I will ask that, I guess, people do that safely. There's a lot of different ways to do that, whether you just leave your candy out in the front or you avoid close contact. However, people, I would guess also there's probably a lot of parents who will just skip the trick-or-treating this year as well. So I'm asking back to the kind of the theme, families to do what they think is best for their family with trick-or-treating.
Since 2 weeks ago when you instituted the city staff masking policy, have there been any more outbreaks? I know you talked about a 5 or 6 person team who all had to go into quarantine.
Yeah, no outbreaks in the city. We continue to see cases here in city employees, just like I think a lot of people are, but I would say there's been no outbreaks in the city. I will also say, at least in my office, I haven't heard one single piece of negative feedback from employees that we have a mask mandate amongst our employees. So as a business, I would encourage you as businesses to consider the same. However, there are a lot of negative feedback about masks in general, but not from my employees, and maybe that's just because they don't reach out to me directly on that.
Why not have a mask ordinance like Brookings does?
Well, a lot of reasons for that. One is, and I alluded to it in my remarks, is this has become so incredibly polarizing that even if I felt the efficacy was there, it has a chance to absolutely destroy a city. And I've seen it, divide a city. Secondly, it's not enforceable. I don't know how you enforce it. It's not enforceable. I'm not going to put our cops in a position where they have to enforce mask mandates. Third, we have a high level of compliance in this city on mask wearing. The challenge is the outlying communities is where the challenge is. So this is not a Sioux Falls issue, and I can't reinforce that enough. That's why I say region, region, region. Southwest Minnesota, Northwest Iowa, Southeast South Dakota, really the entire state. So this is bigger than just Sioux Falls, South Dakota. And so there are a lot of people who take their personal freedoms very seriously in this state, and they take their responsibility for those personal freedoms seriously. And I'm in agreement with that. And so there's not a mask mandate on the table in the near future coming from my office.
Mr. Mayor, how helpful would it be if Governor Noem were to also echo this message that citizens of South Dakota should wear masks?
Well, I know the governor is putting out a lot of messaging on, I see PSAs on TV and other things coming out from the State Department of Health on measures they want people to continue to take. My concern, quite honestly, is for our healthcare partners right here who have said to me, Paul, we need We need some strong messaging to start to slow this thing down. And so that's the reason why I'm somewhat angry and adamant today is I have healthcare partners that are saying, we need help. We need more to be done. And people will go right to masks and say, masks are the solution. Masks are one of 50 tools on this right now. And so, thus me imploring the region to mask, social distance, hand hygiene, stay home if you're sick. If you're a vulnerable population, be smart. Maybe skip church for a few weeks. I mean, all these different tools that will help to slow that down.
I'm going to apologize in advance to you and my colleagues. It's going to be kind of a long and winding question. In World War II, my dad was between the ages of 8 and 12, and he clearly remembers at a time of great threat to our country that Americans and Nebraskans in his case came together, they planted victory gardens. My grandmother knitted bandages. She joined a group that would look and identify enemy aircraft. They had all sorts of shifts through the day and through the week. My grandfather was a farmer. He was exempt. What he did to help the country was to grow food. No one seemed to complain about that level of sacrifice. And are we South Dakotans, are we just soft now? Are we had it too easy for too long that we can't do a simple thing like you said, wear a mask, you're not going to get drafted into the military.
Right.
Is this besides a political thing, is this also a problem with our society?
Well, I can't read that question back for those of you who didn't hear it, but basically saying, what's the deal with our society that we can't take a simple action? And I kind of closed with it with some of my earlier comments that we're asking people to be unselfish in an increasingly selfish society. And that's just me being very blunt. No one wants to do anything for other people. It's increasingly becoming frustrating. So you're right. This is one of several very simple actions. But I think the larger challenge on this, if I'm being candid, is the politicization of this virus and how there are political responses that are Republican responses and there are political responses that are Democrat responses on how to take care of this virus. And that makes it very hard, very, very hard at the local nonpartisan level to lead through this.
What about asking restaurants, if you're not going to put a law or ordinance in effect, asking restaurants, I mean, I was in a packed restaurant, my neighbor was wearing masks, wasn't expecting that. No tables were distanced. We've got a big pheasant event coming up this upcoming weekend where people crowds will be indoors together. I mean, how are you controlling that kind of thing?
Well, one thing we're doing is we're starting an initiative a la Good Housekeeping Seal of Approval, where a restaurant, if they meet these requirements, meaning masks are required, check, their staff is required to wear masks, there's hand sanitizer at every table, they'll get these check marks and they'll get a badge they can put on their door. So consumers can know that's a place I feel comfortable going, almost like they're recognized and they're appreciated for that work. So what I can do as the mayor is put out very strong messaging and model the way. I've done it with my 1,300 employees. I think it's important enough that I'm doing it with my staff, and that's a trickle-down message that we're trying to get other employers and residents to gravitate to, which is why I'm really doubling down on the severity right now. We were really good back in May and June when we didn't have to be, quite honestly, because we had projections that didn't hold. Well, now we're really in our Super Bowl right now, and people are tapped out because they used all their goodwill and their energy of good diligence 4 months too early. And so we're asking them to, now is the time when we really need you to be unselfish and do your part.
So what about that fitness center, just to follow up? I know Vera, Sanford, maybe are sponsoring that this coming up weekend at the Career Center. I mean, they're expected, it's like a trade show with thousands of people.
Yep.
Will they be wearing masks? Will they be required to wear masks?
I don't know you'd have to ask the state on the protocol for the event. Yeah, and right now that facility has protocols, hand sanitizing protocols and things that they make available. But the events, there's no mandates on the convention center for what they can and can't have there. So we rely on the events that book there to take the precautions that their guests are wanting and asking for. So my assumption will be that there'll be proper protocols in place there this coming weekend.
I have questions for the healthcare systems. The Department of Health has not seemed to be able to keep up with the contact tracing aspect of the situation. I can count about half a dozen people that I know personally who have been either close contacts or tested positive, never were contacted, didn't really know for sure what to do with that information. I'm wondering, is this solely on the state to solve that problem? Is there something that either Stanford or Avera are able to do to reach out to people, informing them what they need to be doing to isolate if they're close contact?
So the question being asked is around contact tracing of positive cases, and are the healthcare systems able to provide any assistance with that, as there, per your question, seems to be some gaps in the state process. And really, we do rely on the State Department of Health. We have privacy laws that, it can make it challenging for us to navigate through that. So if we do work closely with the state in regard to employees that perhaps have some symptoms and test positive, but it really does come down to the state, and we're willing to assist as asked and have in the past.
Yeah, I agree that we've recognized that, just the pure number of cases that are turning positive right now are really becoming stressful for the state to be able to contact trace. And one way that we are trying to help, because I agree it is primarily a state responsibility to train those individuals, but we are trying to help more kind of informally. So we've been talking a lot with our primary care physicians and other physicians at the time of testing and evaluation for testing. We're scripting them to tell the patient at that time, okay, if you turn positive, it may be a while before the state contacts you. So if you turn positive, you need to start thinking already about who have I been in close contact with, 6 feet, 15 minutes, and consider reaching out to those individuals to letting them know that they've been exposed and that they need to isolate until, to try to get a jump on that process. And so we're trying to do some of that scripting ahead of time, in addition to when we do call back those positives, we do a little bit of that scripting as well. So formally, we can't do that, but we are trying to informally, get some of that knowledge out there to the individuals as they turn positive or as they get tested.
I have a question for you as well, to follow. Who can get a test? Do you have to have symptoms in order to get a test in South Dakota, or is close contact enough of a qualifier? We've been told people have been told they can't get tested just for having close contact.
So we do follow the CDC guidelines in those testing. So the question was, what does it take to get tested in South Dakota? And so do you have to be symptomatic? Can you be a close contact? So we do follow the CDC guidelines pretty closely for this. And so anybody that has even mild degree of symptoms, we will test. And also anybody that's a close contact. So again, the close contact is back to that 6 feet for 15 minutes. And so that is kind of our criteria. Anybody that fits those criteria, we will go ahead and test at this point. We also commonly get the question of, if I think I might have been exposed, should I wait a while before I get tested? And the answer to that per the CDC is, even though it may be more likely that you test positive later on, we do want to get you tested just as soon as possible. So we are not having you wait. We're getting you tested just as soon as we can so we can get you out of circulation and not expose other people at that time. And that reminds me of one other thing. Earlier I mentioned we're opening up a second testing location at 23rd in Minnesota. I wanted to clarify as well that that's not going to be just a walk-up or drive-up location. You do need to talk to either your primary care physician or to the Avera hotline, 877-AT-AVERA, to get that test order and get evaluated beforehand so that we can kind of have that tracking in place beforehand, and that we can do a lot of the counseling of what to do if it's positive and negative, all those things. So please don't just show up if you see a line for testing. You do need to call first before you come.
This is for the doctors. A week ago in this room, Governor Noem said that the primary reason we're in this situation is not so much that we might not have a surge, but we're doing so much more testing, and hence we're seeing more cases. Is she correct on the science and medicine on that?
So the question was, it's been suggested that we're seeing so much of a surge right now, mainly because we're testing more people. So if you test more people, you find more people, essentially. The answer to that is no. I think it's pretty clear. We are seeing a true increase in cases, and a couple of things that clearly point to that. One, the number of hospitalizations does not depend on how much you test. You're going to get sick whether you get tested or don't get tested, and so the number of hospitalizations has doubled in the last month, and we're worried it's going to keep going up. And so that is clear evidence that we are seeing increased spread. Two, the percent positivity that you can track on the state level, that has continued to rise with a high level of test numbers. So yeah, you can mess with the percent positivity by testing more of this group or less of that group and stuff, but when both the test positivity and the number of test runs are both going up, if we were just testing a bunch of people that were very low risk, we could drop the test positivity down, but the fact both of those are up also indicates we're in a true surging level. But the main one is hospitalizations, because that lags the number of cases by a good 2 or 3 weeks. And so the fact that we're seeing our numbers rise now means we're going to see hospitalizations continue to rise for at least the next several weeks. You can't fake being sick enough to be hospitalized.
I would just add to that, we are fortunate to be in an area where there is good access to testing, and I agree with Dr. Basil, that doesn't necessarily have much to do in regard to hospitalizations. However, it absolutely is part of a mitigation strategy. He was talking about testing asymptomatic individuals or individuals who have been exposed, or frankly anyone with symptoms that in the past perhaps we didn't pay a lot of attention to, now are being tested. And so I think we're identifying a lot of positive patients through that enhanced ability to test. And it does certainly play some role in mitigation of further spread, so that if you're positive, you can appropriately isolate and things like that. And I realize there's exceptions to that, but I think it does provide an opportunity and one of the tools in hopefully stopping the spread of this illness.
All right, any other questions today? All right, so just a reminder, we'll have this press conference in 2 weeks, but potentially if things change, we could have one sooner, so keep your eye out for that. I want to, again, just before I close, these guys are incredible partners. We got incredible healthcare systems in our community, and I want to thank them for their work. People a lot of times ask me what experts I listen to, what blog. I listen to these guys. I listen to our local systems who know this market, who know what's happening here, and we have great partners. So thank you for your partnership with this region. Thank you, everyone. Have a good day.